Hello, my name is Sean Simon. I'm a plastic surgeon here in Miami, Florida. The purpose of doing this video today is to discuss with you some of the equipment and techniques that I utilize in my practice, specifically regarding fat grafting cases. I have an extensive amount of experience in this field over the past 7 or 8 years, doing over 1,000 cases. There is quite a large variety of types of equipment out there and different techniques that are utilized across the United States and across the world. I just want to share my experience, and using some of these different techniques, I've been able to develop a system that works very well in the interest of patient safety and delivering consistent, outstanding results. Fat grafting has become a very important part of my practice over the last 7 or 8 years. In addition to becoming more popular in general, it's something that's more in the public awareness. To have a practice that's a busy cosmetic practice, I think you need to incorporate fat grafting as part of it. It can come in a number of different forms, from breast augmentation to what's very popular is gluteal augmentation, especially in the South Florida area and across the United States as well. I've performed well over 1,000 fat grafting cases over the past 7 or 8 years, most of which are large volume fat grafting cases. They can be performed in a very safe manner and with outstanding consistent results and a very high patient satisfaction rate. I think, like all procedures, especially something new to a physician's practice, they need to educate themselves to a degree where they're going to feel comfortable performing a new procedure for them. First thing is, like all procedures, a careful consultation process with specific attention to the patient's particular anatomy. You want to determine, of course, where the fat will be best removed from for the purposes of harvesting enough fat for the desired result, as well as contouring the areas that the fat is removed from. And then, of course, a careful analysis of the area to be grafted with regards to the specific locations for the fat grafts and the desired volume in order to achieve the result that the patient is looking for. The second factor that physicians should pay close attention to is, of course, the equipment that they use. This is important to plastic surgeons, no matter the type of procedure that we're talking about, and it's no different with fat grafting. Having done this procedure many times over the last 7 or 8 years, I've gone through a variety of different types of equipment, and I've personally found that the red head container and fat grafting harvesting system is the one that is the most efficient and delivers the most consistent results for my practice. Cannula selection for fat harvesting is very important. The style, length, size are all critical factors in achieving the results that you're looking for. Just like within any type of liposuction, liposculpture procedure, picking a cannula that's going to work with the patient's anatomy is very important. It's more important in fat grafting because you're not disposing of the fat that's harvested, you're actually utilizing it. So you need to obtain adequate fat volume. You need to obtain a fat in a way that the adipocytes are going to remain viable and in an efficient manner. So certainly the selection of your cannula is going to be very important. I like to use a cannula similar to this, which is a blunt-tipped 4mm cannula, somewhere between a 3 and 4mm cannula, usually between 15 and 22 to 25 centimeters in length, depending on the case. I like the blunt tip because, especially with the gluteal augmentation, you are injecting the fat into multiple planes, including the subcutaneous plane, the muscular plane, and submuscular. You certainly want to avoid an intravascular injection, and by using a blunt tip cannula and careful technique, you can avoid that. The equipment they use is very important, of course. Over the years of doing these procedures, I've adapted the equipment that I utilize in the operating room based on what's available. I currently use a red head system. This allows me to collect fat in a very safe, efficient manner. and deliver outstanding results on a consistent basis. This is a redhead canister. It's used for fat harvesting, especially in large volume cases. You can see that the canister will allow you to collect a significant amount of fat, close to 3,000 cc's. So certainly enough for the great majority of cases you're ever going to do. All the fluid from the liposuction is collected into the main canister, and the extraneous fluid goes to the bottom portion, where it is removed to a waste canister through a bilge system. So everything is an automatic, closed, sterilized system. It's one-time use. You do not have to clean this afterwards. It can be simply discarded, and there's a very reasonable price. It does not really add to the cost of the surgery. So I like to have a one-time use system. There's no chance for cross-contamination between patients because of that. And also, of course, the staff that are working in your operating room will be very pleased, because cleaning a system that you're going to use over and over again is extremely tedious and difficult to get it very clean and prepared for the next sterilization process. Once you've completed your procedure and the fat has separated and collected in the upper portion, this tube at the bottom is used to simply transfer and very easily transfer this fat directly to your TUMI syringes for injection. So therefore it remains completely closed from the patient to the canister, waste fluids out, and then your fat grafting material directly to your sterile TUMI syringes for injection. It's never open to the environment, never exposed to air, and very easily separates your fat while you're doing the liposuction portion of the procedure. I use power-assisted liposuction. I've been doing that for many years, before I even was doing fat grafting cases. And that allows me to collect the fat in a very quick way, but also to deliver an outstanding result as far as the locations that you're sculpting. I have not noticed that. I mean, I think with the power-assisted liposuction, you're actually not traumatizing the cells more than you would with a traditional system. You actually use a lot less force when performing the harvesting of the fat because of the power-assisted component. So it actually ends up being a more gentle procedure as far as trauma to the tissues. I believe that if you keep the vacuum pressure at the proper amount, which should be really a maximum around 18 millimeters of mercury, this will eliminate any undue trauma to the adipocytes themselves. Really haven't had a lot of issues with these types of cases. I think that if you are integrating this into your practice, you should really expect that it's going to have one of the least amount of complications, if not the least, in your entire practice of plastic surgery. The results are consistent. You can get long-term results. I've had multiple patients that are several years out of having this type of procedure that have maintained a significant, if not the entire amount of fat that's been grafted into their buttocks. There are certain things you can do to augment the effect of the grafted fat or to enhance the take of the fat, in addition to using the proper technique and equipment, such as using platelet-rich plasma. There's a growing body of evidence to show that platelet-rich plasma, when added to the harvested fat, will enhance the take of the fat grafts for these patients. Of course, proper post-operative care and routines are also critical to maintaining the fat grafts as well. When harvesting fat using the redhead system, of course, like any harvesting of fat, there's tumescent fluid, and then there's also saline in the redhead system itself. So there is a fluid component. However, the system itself is what separates that fluid from the harvested fat and prepares it for fat grafting. If you have a little extraneous fluid within the fat that's going to be re-injected for your grafts, I find that to be useful because it allows for an easier transfer of the fat through your syringe and cannula. So there's less trauma to the tissue as you're doing that. Any small amount of extraneous fluid will be resorbed quickly in the body, but there is certainly not an excess of fluid. By planning the procedure correctly, you will allow for sufficient time of separation of the fat from the extraneous fluids. For example, if you have a case where you have an excess of subcutaneous fat allowable for harvest that you are removing, once you obtain the amount that you deem to be sufficient, you can do the remainder of the liposuction straight to a waste canister and allow for the fat that's in your canister and the redhead canister to separate, and by the time you're finished, you have the fat is completely ready for transfer to syringes and to be re-injected. If you're utilizing all the fat that you're harvesting in a particular case, you may have to wait a few minutes upon completion of the liposuction, but it's really no more than that in order to prepare your fat for transfer to your syringes and then ultimately to be re-injected. So I've personally not found this to be an issue, and if anything, a little bit of fluid is helpful. I would say it's extremely rare to have any clogs, whether you're talking about in the system itself or within the cannulas once the fat has been transferred. Now, when we're talking about low volume cases such as breast augmentation, I utilize a syringe harvesting technique. The reason I do that is because I'm using much lower volumes. I allow the fat to separate within the syringes themselves with gravity. They are re-injected with micro cannulas through Lorlocks, so I like smaller particles, therefore I use smaller cannulas for the harvest as well. And with that technique, I've had no issues with clogging. I think any competent plastic surgeon is going to be able to integrate this type of procedure into their practice very easily and very quickly. Certainly there are training opportunities available. Most of the major aesthetics meetings will discuss fat grafting cases and techniques, just like with all types of plastic surgery. My practice is open to training other physicians as well, and there's certainly other doctors that will provide that sort of service. But once a surgeon learns the basic techniques to provide an outstanding result in a safe manner, they'll be able to quickly incorporate this into their practice. Absolutely. I mean, part of, I guess it's learned through your training, through your residency training. You enjoy working in an environment of education. I certainly have had plenty of doctors rotate through my practice to learn different techniques in a variety of surgical things, including laser-assisted surgery. I've had medical students rotate through my practice, so it's something that I enjoy doing, sharing the experience that I've had with other plastic surgeons so they can incorporate those things into their practice.